Hello and welcome. Welcome to the Baker Senior Show. Today we have Steve Baker, who is going to give us some information about Medicare. And today's topic is very important if you have some problems with your Medicare. So Steve is not only going to answer your questions about Medicare, but he's also going to go over a presentation today that will explain a little bit about Medicare and what happens if you get a diagnosis of cancer. Nobody really wants to talk about that, but if that's happening to you, I know that's something that you want some answers for right away. So, hello, Steve.
Hello.
I'm so
glad to be here. Glad to be
yeah.
here today.
Well, I'm glad you're here too. And I know anybody that is either getting ready to go into Medicare is glad you're here, and anybody who is already in Medicare and having problems, they're glad you're here as well. So tell us a little bit about what's going on today, Steve. What brought you to this particular topic?
Well, I wanted to talk about not necessarily just cancer, but cancer or any major illness of any sort. And as we all get older, there's a likelihood, or more of a likelihood, that we will be faced with some major health issues. So I wanted to talk to you about the Advantage, and just to do a review, I've discussed the two kinds of Medicare. You must be in either one or the other. You can't be in both. On the one side, you've got what I refer to as traditional Medicare with a supplement, or this mostly it's called nowadays, it's called a Medigap policy. And there you have Medicare itself will pay about 80%, will pay 80%. And then with your A and B, pays 80%. The supplement will pay the remaining 20% with a very slight, small deductible.
Okay, Steve, I'm going to ask you to pause there just for a minute.
Okay.
For those of us like me who are not in Medicare yet, you're throwing out some names and some statistics and things that I'm unclear about. I hope you don't mind me stopping you to ask you a few questions. Okay, good.
No.
So there's only two types of Medicare, the Advantage plan and just the plain Medicare. Is that true?
That's correct. You can use the word traditional.
Oh, traditional Medicare. Okay.
Traditional Medicare. And then on the other side is the Advantage plan.
And are both of them run by the government, or is one run by insurance companies and one is run by the government?
Well, they're both of them are in combination with the government and private companies in different ways, and it's a little complicated to explain how those companies fit together, but it's a partnership between the government and the agency that runs Medicare overall is called CMS, Center for Medicare and Medicaid Services, CMS, and they're the referee and they're the directors. So they fit in in two different ways. One is through the traditional, and they have certain rules and regulations, and then the other one, the Advantage plan, is more highly regulated. But they both work in combination with each other, the government and private insurance agencies.
Okay, but somebody's in charge of keeping those private insurance companies from taking advantage of us.
Yes.
The CMS.
CMS.
Okay, I see. I'm starting to get it. But like you said that word complicated, and it does seem complicated because when you hear about Medicare, you just think it's the government. Okay, that's our government. We paid into Medicare, we paid into Social Security, and now we want them to handle it.
Right.
And they said, well, it's a little more complicated than that.
Well, complicated is an overused term. You know, if you work with someone who knows what they're doing, they can explain it very easily to you.
Right.
But But at any
Oh,
rate, as I say, there are two sides, and today we're going to emphasize the advantage side of
okay,
Medicare.
okay. So if you have the Advantage plan, or you think you might want to run in, that's where you want to go when you sign up for Medicare. You think you might want the Advantage plan. What Steve is saying is that there might be a complication if you get a diagnosis of cancer. So take it away, Steve, and tell us a
Well,
little bit
yeah.
more about that.
Well, a diagnosis of cancer is a diagnosis of cancer. So when you start using your program, whether you're on the traditional side or whether you're on the disease itself, of course, is the same, or whether you're on the Advantage side. But
Okay.
for years, people have been out in the workforce, and almost everyone at one point or another has received a paycheck. And when they receive a paycheck, there's a little block that says Medicare, and they take a certain portion of that out. That goes to pay for the Part A of Medicare. So you paid into it all through the years, and then when you start using it, you're issued a Medicare card when you turn 65. Most of the time, you've got to have 40 quarters in order to qualify. But 40 quarters, I mean, you've got to have been working for at least 10 years, participating in paying into it. If you have a spouse who's done that, then you're qualified. So there's some rules and regulations there on whether you can even get Medicare. 40 quarters will do it. That's 10 years. And if you've lived to 65, and mostly you have worked at least 10 years, I had 40 quarters paid into it. So on the other side is the Advantage side. And that's the area that I want to talk with you mostly today. There is a publication. It's called Medicare in You. Get this straight here, Medicare in You, and it's free. You can pick up a copy of this at your local Social Security office, and it's the one you will pick up will be sort of framed up for the local situation. For example, Marion and I are in the state of Texas. So these are all the Medicare Advantage plans in the back of the book that are available. See this? They're available, a whole lot of them. And these explains all the different ones that are available. There's several of them, probably as many as 40 or 50 in our local area, Marion. And if you live, say, in
And where'd you say
Pennsylvania,
you could pick that up, Steve?
Social Security office.
Oh, okay.
Go to your local Social Security office. So if you'd like to know more about it, you can get the services of an agent who can explain it a little more. But
like you, Steve.
Like me, exactly.
Yes. Well, if you'd like to get a hold of Steve and ask him some direct questions that we don't cover today on the show, you can call Steve. I have it up on the screen, but just in case you're listening to this as a podcast, I'm going to read it to you. Please don't write it down if you're driving. Just come back. You can see us live on YouTube and on Facebook on the Baker Senior Show. It's 832-754-3292, and that way you can get a hold of an agent, a licensed agent who can answer your questions, and this one happens to be Steve Baker. And Steve has been a licensed agent for many years, and he's got lots of clients with a lot of different opportunities to learn Medicare, including yourself. Right, Steve?
Exactly. I've been on I'm not going to tell you exactly how many, because then you'll be able to you figure out my age, but I've been on Medicare for quite a few years myself. My wife is a user of Medicare, and we both are. So we have our program set up. So I'm not only knowledgeable about it, I'm also a user of the product.
Yes. Now, I know we're going to get a little more into Medicare Advantage with a diagnosis of cancer, but I have one question that's really eating at me. And if it's a question I have, I'm sure our audience has the same. What if you don't qualify for Medicare? What if you were a housewife or you were disabled or another reason why you just didn't want to work because you had plenty of money at the time, but now you're a senior, you don't have much money, and you don't qualify? What happens then?
Well, pretty much Medicare goes, they've through the years they've tried to cover just about everyone. There's something, and once you get into studying Medicare, there's something that's called a D-SNP or a dual SNP, and you can get onto a Medicare program such as an Advantage plan with almost no money at all. So if you're low income, you qualify for certain areas.
Okay.
They have to review your income and your situation, but you can get on a plan.
Okay.
There's no question. Almost
Good.
everyone can do.
You
Yeah.
got some of us panicked, like
Right.
uh-oh.
As long as you have the 40 quarters in, that's fine.
Okay.
Or a spouse, or you're married to someone who has 40 quarters. So
Okay, good. Excellent. Thank you.
yeah.
Okay, so let's continue with our
Okay.
Medicare Advantage plan with a diagnosis of cancer.
Right. And right away, I want to hat tip my good friend Christopher Westfall, who's at Senior Savings Network, and I watch his stuff a lot and learn a lot of from him as well. But today I wanted to talk about if you happen to choose the Advantage side of Medicare, there's some things that you need to understand. You have to be very careful about it. And the reason I say that is because there's something that's called copays and deductibles, and in the Advantage plan, you have a lot of those. If you happen to have, I chose cancer because I've had cancer myself, and I'm cured. My wife has had cancer, so as you get into senior years, you have an enhanced chance that you will be diagnosed with some form of cancer. And as you know, almost everybody knows, there are many, 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 many different kinds of cancer. Whenever you receive a diagnosis, you can almost expect that there's going to be some kind of major expense involved. Now, on the Advantage side, there's something that's called out-of-pocket maximums. And a lot of times when you meet with someone or you talk with someone, this is not explained totally to someone. Those out-of-pocket maximums can range from $2,500 up to almost $10,000. And you have to, when you're going to have some serious discussions with your doctor as far as the cost, because you've got to, for example, if you go into a hospital for a diagnosis, then you've got to come up with some money. We're talking about the Advantage side now. You've got to come up with some money for the tests and the x-rays and the so forth. If you have a diagnosis and the doctor recommends chemo, then there's chemo treatments and so forth. So you can reach what's called your out-of-pocket maximum. In other words, let's say in almost anybody's case, so let's say they have a $3,500 out-of-pocket maximum. Then they've got to come up with some money each time they go into the hospital, or each time they have to take treatments. Chemo treatments are very, very expensive. But the plan will say after you yourself have met, let's say, as an example, $3,000, you come up with $3,000, and then, and this is key, for that year, you don't have to come up with any more money. And those can range from, as I say, depending on the plan, from 3,000 to 10,000. So at the end of the year, though, that resets. In other words, you still have the cancer, you still have the heart disease, you still have whatever it is you've been facing. Then it resets. So you're obligated again for the next year. For example, we just passed the turn of the year. That resets. So then through the year, you're obligated again for that amount of money to meet your maximum out of pocket. So a lot of times when someone talks to you about the Advantage plan, they don't emphasize that so much. But you have to be very, very careful and understand. Back on the traditional side, your maximum out of pocket, so to speak, is a small deductible of $198. So you have $198 deductible as opposed to $2,000 or $3,000 or $4,000 or $5,000 out of pocket that you must meet. So that's one of the major emphasis. Yes, one of the major situations in the Advantage plans. I'm not totally against them, because if someone has limited resources, then that could be the answer for them. So that's what people really don't understand, and they need to do some research. For example, if someone is just now turning 65, you're in what's called an open enrollment period, and there you're free to choose one or the other. And you can get a supplement plan for around, depending on your area, you can get a supplement plan for around $100. And there you're on the traditional plan, and you're pretty much, for all practical purposes, you have 100% coverage. There are major hospitals throughout the country. For example, Marion and I are familiar with our area. It's a place called MD Anderson. If you're up northeast, it's Sloan Kettering. If you're up in the Midwest, it's called Mayo Clinic. So those are the places people would really love to go if they're diagnosed with cancer. But unfortunately, I know specifically with the case of MD Anderson, they will not accept the Medicare Advantage plans at all. So then you've got to search around and find alternative plans and treatment. And a lot of times you're panicked, you don't know exactly what direction to turn, and it creates a lot of stress. So I encourage people to up front make sure that they understand the Advantage plans and how it works. So and also you're in a network of people. In your network, they call it the network. So you're assigned a primary care physician, pretty much. And then there's the two kinds of Advantage plans. There's the PPO and the HMO. Preferred Providers Organization is the PPO, and the HMO is different. So you just make sure, if someone is talking to you about an Advantage plan, make sure that you check in with someone so that they can tell you what you're in for, just in case something major could happen. It doesn't have to be cancer. It could be an automobile accident, a major automobile accident. All kinds of things can create a major situation. So you have any questions, Marion?
Honestly, my stomach kind of is turning around, because how could you possibly know you're going to get cancer or get into a car wreck? It just seems to me like we're really at a disadvantage when it comes to Medicare, because if you choose that, because somebody talks you into it, a salesperson, if you will, and this happens to you, then what? You choose to not get treated for cancer. You choose to not, stay in the hospital. When, it just seems very yucky. It's not a good feeling.
Mm-hmm.
So I'm glad that people have you to go to instead of somebody who's trying to sell them something. And not that you're not a paid licensed agent, but you really care about people and you're willing to take the time to explain this to them. And
Mm-hmm.
I feel grateful and thankful that I know you, and that when I turn 65, which is not that long from now, I know that I have somebody I can trust that will tell me the truth, that won't bypass, the things that might happen.
Mm-hmm.
I really don't have any specific questions, but we do have an audience question if you're ready to take a question from the audience.
Sure. Go ahead.
Okay. So this is from Facebook, and I'm going to put it on the screen, but for those of you who are listening on a podcast, I will read it and then Steve will answer the question.
Okay.
This comes from Jody Binberg, and she says, how could anyone even successfully find in-network secondary support? For example, although my doctor is in-network, he recommended a non-network pathologist for a minor procedure. I have spent hours and hours calling apparently in-network pathologists without any success whatsoever. This burden seems to fall on the patient's backs and not the doctor's. Any ideas?
Well, right away, she uses the term network, and you're pretty much, if on the Advantage plan, you're pretty much confined to providers. We call them providers, or to just another word for doctors. You're pretty well limited to what physicians are in the in the network, and if you're trying to go outside of the network, probably the best option is just go ahead and pay cash for the procedure. I think she said the pathologist. Is that correct?
Yeah, she said she had a minor procedure that needed to be completed, and she was having no luck calling the people in her network. Now, I'm not really sure why she's not having luck. Is it because she's not here for me to ask her specific questions? But it seems to me like if she's not having any luck, maybe they don't have time for her. Maybe they're too busy. I'm not really sure what the problem would be.
Mm-hmm.
If she has in-network pathologist, why can't she get somebody to help her?
Mm-hmm.
So I'd like to hear from Judy, and we can answer that more clearly in the future. So Judy, please let us know if you have more specifics, or maybe next time you can come on the show. Steve, do you have any ideas on what she might be trying to say here?
Yes, I do, and it's you're faced with that all the time, and the key word is network. If you're on traditional Medicare with a supplement, you're free to go to 97% of all the providers out there. You just give them a call, you give them your insurance information, and typically they'll say, "Sure, come on in." Because you've got what kind of insurance do you have, and you just tell them. They say, "Okay, great, come on in." Same way with let's say MD Anderson. If you've got a supplement, traditional supplement that you've been paying for all of these years, remember you paid for this up to this point, and it's just common to go ahead and add a supplement to get the remaining 20%. And you can go to any doctor pretty much across the country, in any state, in any county, wherever you are, and it's just a worry-free kind of thing to have. It's what I call healthcare peace of mind.
Yes, and I absolutely have that up on the screen right now. This is the Baker Senior Show with Steve Baker, and his tagline is healthcare peace of mind, because He's very knowledgeable. He's accessible. You can call him at any time. He will meet you, or if you're not in our area, he will talk to you on Zoom, which is a program that you can see each other on the internet. As long as you have a laptop or a PC that has a camera, you can see him and he can see you. Of course, there's always the telephone. That goes anywhere, right? I mean, you have to have a camera for that. Although
Right.
most of our new cell phones have cameras, so you could do a little visual with Steve. But don't let anything stop you from reaching out and talking to Steve about your questions. It doesn't seem to me that it's cut and dry. It seems that there are circumstances that you might need to talk to Steve about when you're choosing your Medicare plans.
Mm-hmm.
And I know that, Steve, you have some case studies, some stories of people that did something and it proved to be wrong and they called you to try to get out of it. So can you tell us a little bit about that? What if you chose Advantage and now you want out? What happens?
Well, first off, if you're within 1 year, you can get out very easily within the first 12 months. So you've used it and you've explored it some, and you're just saying, I'm not happy with this. But say you turn 65 and you're enrolled, you can get out within the first year fairly easily. If you stay in longer than that, there's certain periods of time you can change, and there are other times when you cannot. So I'm not going to go into all the acronyms, but there's the SEP, which is a special enrollment period. There's the AEP, which is the annual enrollment period, and various kinds of periods where you can do certain things and other periods when you cannot. But I can evaluate your situation and come up with a good answer for you, or at least a reasonable answer for you.
A reasonable answer. That's funny. So tell me, Steve, if you're getting ready to turn 65, or let's say there's somebody watching here who's taking care of their parent and they're getting ready to turn 65, when is it that they need to call you? When is it that they need to schedule time with you to make this decision?
Well, ideally 3 to 6 months out. 3 months is fine, because you can usually set up. You need to apply to get your Part B. You have your A, as I've explained. You paid for that through the years, so Part A is already set up when you turn 65. But you do need to be proactive and get online or go to this local Social Security office and sign up for Part B.
Can they sign up through you?
No, I can help them and I can guide them and tell them where to go and who to call. And I've even gone. I haven't done it lately, but I used to go all the time. Just take someone and go with them to the Social Security office. I've even done that. But now I'm a little more busy, so I don't do that so much. But you can do it online. And if you can have if you have a younger person, a child, by child, I don't know, my grandchildren are telling me all what to do on the computers and everything. But if you go online and go on Social Security, and there's a place there where you can actually sign up for your Part B, or you can go to your local office. And by the way, they have initiated a system where they can work you through real quickly. By real quickly, I mean within 30 minutes or so, you can go to someone's window and start talking to them about your situation.
Oh,
And you
Steve,
can have some banter back and forth.
I have a question about that. So you said when you turn 65, you're already enrolled. Do they immediately send you a card on your birthday? Do they send you a Medicare Part A card?
It's usually, it depends on whether you're on Social Security. If you're actually taking your Social Security, in other words, if a lot of people don't know, but you're eligible to start taking Social Security at age 62. And like everything else, there's some ins and outs and things that you have to know, and you have to maneuver around and so forth. But at age 62, if you've already started taking a Social Security check, and when it comes time for your Part B, typically you will be sent a card automatically.
Okay.
If you're not taking Social Security, you've got to be much more proactive and go out and sign up.
Gotcha.
All those little twists and turns you need to know about.
I understand, and you're the guy to call because every situation is going to be a little different. So I have Steve's phone number up. Our show is over for today, but we are here every single Tuesday at 8 o'clock to answer your questions, to get involved, to find out more about Medicare and you. So please feel free to give Steve a call at 832-754-3292 about you, your Medicare issues, questions, or your parents, if you're trying to help with parents. And we are live on YouTube and Facebook at 8 o'clock Central Time every Tuesday morning. And we also have a podcast where you can listen to our show anytime and also watch the replays at any time. We thank you for being here today. Steve, thank you for all your knowledge and your time.
Glad to be here.
Bye for now.